Hi, my name is Dr. Jay Mounjaro, and I'm the physician in charge of obesity medicine here at Kaiser Permanente in San Diego. And I'm here to talk to you for a couple minutes about some of the latest weight loss medicines on the market called glucagon like peptide 1 receptor agonists. But you might know them like some of their other names, like semaglutide, Ozempic, Wegovy, tirzepatide, Zepbound, or Mounjaro. Let's start by talking about the disease of obesity. Obesity as a medical disease has a definition, and that is anyone with a BMI over 30. But we also worry about patients with a BMI of 27 or above who have certain medical conditions like diabetes, sleep apnea, fatty liver disease, or cardiovascular disease. It's important to remember that when we talk about treating the disease of obesity, we always have to start with a good foundation of diet, exercise, and lifestyle. If you haven't already, please consider enrolling in our Renew program, which will give you that foundational knowledge to make sure that your weight loss journey is successful. So, how do these medicines work? Well, GLP-1s work a couple different ways. First thing they do is they help balance the sugar level in your body, but more importantly, they also slow the transit time of food through your system. So that means that food you ingest will take longer to move all the way through your gastrointestinal or GI tract. We talked about who should consider taking these medicines, but it's also important to know people who should not consider taking these medicines. Specifically, anyone with a family or personal history of something called multiple endocrine neoplasia type 2, or anyone with a personal family history of medullary thyroid cancer should not take these medicines at all. And anybody with a personal history of gastroparesis, pancreatitis, or small bowel obstruction should really consider whether or not these medicines are right for them. So, what are some of the side effects of these medicines? Most common side effects we see are nausea, vomiting, constipation, diarrhea, and stomach pain. And if you think about how these medicines work, you can understand how these side effects would happen. So, anybody who might be eating too quickly and put food into their system too fast, when the food isn't moving through as quickly, they might experience stomach pain or nausea. And in the same way, when the food doesn't move all the way through your system quickly, people might experience constipation. So let's talk about how these medicines are given or dosed. I just mentioned the side effects that people can experience, like nausea, vomiting, and stomach pain. And when they did the studies of these medicines, they found it was really hard to stop those side effects from happening. So, what they did when they put these medicines out is they put them on a dosing schedule that slowly ramped them up over time. So, the first month of the medicine is really considered what we call a subtherapeutic dose, meaning that most people don't notice any effect in the first month of taking the medicine. At the second month, we double up the dose. Some people notice effects, some people don't. Most people notice the effects of the medicine and the medicine working by the third month when they take it. What are some other ways we could reduce the potential side effects that people might experience? The first thing is to eat only when you feel hungry. Don't eat because the clock says you should eat. Eat when your body tells you you should eat. It's also important to make sure that we're eating really healthy foods. We talked about the foundation of a good, healthy diet. That's really important, not only to help weight loss, but also to help minimize the side effects of these medicines. So, you want to eat lean proteins like tofu, chicken, fish. You want to eat lots of unprocessed vegetables like spinach, eggplant, mushrooms, kale. And you want to incorporate healthy fats like avocado, olives and olive oil, nuts, and seeds. So, to summarize, GLP-1s are not a magic pill. They're really only going to be most effective when coupled with a comprehensive program of diet, exercise, and lifestyle. And we're here to help you cultivate that with our 15-week Renew program. If you've already signed up for the program, enjoy. If you haven't, please click the link below. Thank you for your time.